Welcome to Washington Policy on the Go. My name is David Bose. I'm the Communications and Marketing Director for Washington Policy Center. And every week during the legislative session, we host a lunchtime event that is called Washington Policy on the Go, so that you can be better informed about what's happening in Olympia. Our center directors are always watching multiple pieces of legislation, multiple proposals, and providing you analysis and alternatives for what is proposed in Olympia, what direction that we're headed, and where we should be going. So we try to provide those things for you in addition to some other informational bits as well, making you the most informed person in any room when it comes to Washington's legislative coverage and policy approaches. So we will be joined again by Todd Myers, our Center for the Environment Director, momentarily, and Elizabeth Hovde here in just a moment. I did want to mention that the Supreme Court of the United States made the announcement that they would not be looking into the Quinn v. Washington decision. That's our income tax on capital gains issue that was being, I guess, what's the word, considered or conferenced by the Supreme Court. They decided they were not taking that up, which is not uncommon. It's very, it's a long shot for any case to make it all the way to the Supreme Court and actually be heard by the U.S. Supreme Court. So we don't expect the court decision. However, over 400,000 Washington citizens have already lifted their voices and signed on via the initiative process, saying that they want a voice on what's happening. So the next step is to hear what the legislature and then the voters have to say about that. So we'll be watching that issue and providing you the analysis as it is relevant throughout the year on that issue. Now, right now, I want to turn to Elizabeth Hovde. She is our Center for Healthcare Director, also our Director for the Center for Worker Rights. What are you watching right now in the legislature? What has your attention? I know that's probably too broad of a question, but let me first focus on like your top issue. What are you looking at right now in the legislature?
I see energy for changes that could help healthcare access, such as a bill having us join a physician assistance compact. That's a lot like last year we were hoping for the ability to join a nurse licensure compact, and that legislation passed and is helping people across the state with more ability for nurses to be mobile and called in where they're needed and not face a licensing restriction on them helping out. Another bill sets up a contact force if it passes, and there's a promising bipartisan bill that would lift certificate of need requirements for psychiatric hospitals and beds. The legislature is talking a lot about this being a session where we tackle behavioral health. So I find it hard to believe they would say that as one of their primary goals and not lift certificate of need for psychiatric beds across the state. I also see a variety of bills that work against cost containment of healthcare. Healthcare costs are soaring and they continue to go up. We saw an estimate for insurance rate increases at 9% for premiums. And that needs to be a state priority. And the legislature says cost containment is a priority, so much so that they're seeking a taxpayer-financed, government-run system of healthcare instead of a free market system. But, more regulations drive up the cost, and we're seeing bills that propose regulations. And one bill I saw this week talks about the inability to garnish the earnings for judgments that arise from medical debt. And so you wouldn't be able to collect on medical bills not being paid. That will drive up costs. That could also create an incentive for people not to pay bills. But things like that, I find work against cost containment for healthcare. I also looked at last week a bill that concerns unemployment benefits for striking workers. So not what they're intended for, not appropriate, but that's being considered heavily by the legislature right now.
Yeah, that's incredible. That's one of those incredible ones. You brought up so much there, but just the idea of unemployment being for a strike, like a replacement, it'd be like a striking fund, and essentially.
Yeah.
The incentives that creates and the unfair playing field between, company, I mean, it removes government from neutrality, right? Because suddenly you're funding the strike. You're making it more likely, and that'd be difficult, I
And,
think.
when we're looking at low-income workers, there was a lot of talk about the Starbucks workers who are working for a new contract with management and them striking, and how low-income workers need the ability to survive while they're on strike. Well, the unions that represent them, or say they want to represent them, should be looked to for the strike fund. There is no reason why taxpayers should make it easier for people to strike and not negotiate with management. It's just a backward way of thinking.
Yeah, and when you brought up the attention that Washington State pays toward the government-only healthcare plans, they call it universal, but it's one of those things where when people say universal or all access, they think, I'm going to be able to go and get what I need when I need it, and then the details come in where it's you technically have access, but everyone has equally poor access, right? Unless you have some other alternative means to get there quickly. That's why, when people actually need health care for, serious issues, it's not uncommon for people to travel into the United States from other countries that claim to have this universal access, because it has to be slower, and they have restrictions and other things that can keep people from getting the help they need as fast as they need it. But one of the interesting things that you brought up last year on this program was that when Washington's exploring it, they have this committee that's been exploring this for a while, that they hadn't looked at other states that had tried it, because there's been plenty of states that are left of center that have wanted to do this. They make the grand gesture, and then suddenly, once it becomes real, once they have to actually, implement, and say, this is how much it would cost, these are the taxes required, without exception, even the most left-leaning of states have said, whoa, we're out. They still say they want it, but they want to shove it to at the federal level, generally speaking, which is because they can print their own money, presumably, and apparently 32 trillion is not enough, so
yeah, the pattern of universal care in countries that try it is a lack of access and lower quality, and it's high cost, of course. So the inability to look at examples all around us, even our own Veteran Affairs system is an example of universal care that's not working. So I don't know how we think we're going to escape the problems that are associated with taxpayer finance, government run healthcare. And it's disappointing to see that direction continuing to be the direction we had. I haven't seen many bills so far related to that this session, but there's just this and when you watch that committee, they're talking about smaller chunks of the pie and little ways to make government-run healthcare more accessible and more people eligible for it. There's now the ability for undocumented workers to have government financed, have subsidized healthcare from taxpayers and that kind of thing. So as they continue to look toward that, I'll keep looking for bills that inch closer. But right now, it's a big work study and a commission leading the way on that.
One of the blogs that you focused on over the past couple of weeks has been the HB 1959 that would remove the exemption for small employers when it comes to the state's paid leave program. Can you describe, what that would look like for a small employer, what the significance of that might be, and is there any exemption that would be left over, or do you know yet?
No, it's so frustrating, when the paid family medical leave program passed in 2017. I wasn't watching it at the time, but I hear and see lawmakers and people in the community, businesses talking about how they finally negotiated this agreement that small employers with fewer than 50 employees would not have to pay into this fund that's available for people to take medical or family bonding leave with a newborn, that kind of thing. And so getting rid of that exemption is going to cost people, it's going to cost the employers a lot. And it's just going back on the promise. What they should be doing is relooking at the program as a whole. I mean, like Washington Cares, you're paying a benefit to some workers, not all. And there are other ways that employers can give benefits that you're usurping because you're taking the money for a benefit that's imposed by the state, not used by all. Some employers don't even have anyone in their childbearing years or things like that. So it's a silly benefit for them to be paying into. It's a silly benefit for the workers of a certain age to pay into. It's just really misguided policy that doesn't allow for individual choices or meeting the life needs that all of us do have. That's what the government should be interested in, is letting us use our money for the needs we have and not becoming government dependent. Instead, they're creating these savings accounts here and there that you have to save for this, and everyone else will benefit, whether they make more money than you, whether they have resources and don't need taxpayer help, and so on. So it's frustrating to see that promise possibly broken. I hope that's not the way this goes.
You had a publication of late as well about how the state needs to get out of the dues collecting business, which, for a lot of people, they might say, well, wait a second, dues are always collected, from public employees through the state. But I like this approach because you're kind of taking a step back and saying, well, why are we doing it this way when, the people don't, if you belong to any other private group, that you don't get, the government doesn't come along and deduct the dues for you to make sure that you're there and in it,
Right.
the dance class my kid's in, nobody's deducting that from my check. I gotta go and pay it in person. So why is this any different? Why don't you describe that publication and why you did it?
Yeah, I'm interested. There's activity around the states and in the courts and in states legislatures talking about this this role that states are playing in collecting union dues. And, it's helping keep hidden people's Janus rights. Janus rights are First Amendment rights that the Supreme Court saw fit to give people. It gave them the right to join a union or not join a union and not be required to pay dues as a condition of public employment. But it really confuses the issue when you are having the state deduct it from your paycheck without you seeing it, without you really knowing what's being deducted sometimes. And it's just keeping people in the dark about their rights to not pay a union if they don't want to. And I pay my Netflix bill, the government doesn't pay it for me. It should be like that. You should see what money is going out, what money is coming in, and unions that are really representing their employees well and not shunning them if they don't agree with them at times, which is what we often see, would be able to still collect, they can still make the case that they're valuable, and if people believe that, they can pay. And seeing that payment go is something that makes a lot more sense than having the government just take the money out of your check. And the government doesn't offer a lot of information about a person's Janus rights, even on websites that talk about employees' rights in the workplace, public employees' rights in the workplace included. It doesn't lay out what the Janus rights are and that they have a right to not join a union if they don't want to. And I find that odd. And it works in concert with this automatic deduction on their paychecks.
Yeah, it's kind of an incredible thing when you think about it, where you've got the break room poster with all the different rights on there, except for the Janus rights. Janus rights are kept off, and then government coming along and then doing this service, which kind of, again, it removes the neutrality. It's government coming along, and the implication is kind of like, okay, well, I got to do this, right? Instead of informing people. I can't
You
think of
just think
another
it's a
example that would be
deduction you
like that.
have. Yeah, you think it's a deduction that's natural, you've got it, nothing you can do about it, somewhat
Like
like
Social Security,
long-term.
unemployment, or anything else, you're stuck with it, and that's not so.
Yeah, I timed that publication the way I did because I really wanted a lawmaker to take it up. I haven't had that happen yet, but hopefully someone will be interested in it.
That's the nature of WPC work. We provide the tools and analysis for people to then look at that and then say, you know what, that seems to make it better. That makes sense. We're going to run with that. Um, Tom has a question. He says, people often point to Canada or European healthcare as examples of systems that work. What can we learn from them?
We can learn that what they've done is created a two-tiered system. Like Dave said earlier, you see people crossing the border to get care. You see people going to places like the Surgery Center of Oklahoma to get care that they cannot get in their country. So you're already creating not universal healthcare or two-tiered healthcare, people with access to care and people without. And we can point to the waiting lines. There's studies that show the waiting for ambulatory service. There are studies that show the amount of time it takes to get from a primary care visit to a specialty care visit, matter of months. And these are things that we don't want to see in our own healthcare system. And I just really think we need to start looking at models that are not universal care because we're seeing those models not work.
Well, thanks, Elizabeth. I know you're watching you're watching a dozen, maybe a couple of dozen of bills at this time, and that requires watching a lot of hearings, a lot, a lot of different committee works, which can be tedious and difficult. But I
Don't
always
ask
appreciate
me
the
one
work.
of their numbers. I have to look up every single bill every single time because I get so confused.
I've always been that way. You have to write them down because, even when I worked in the legislature, I was able to remember the numbers. But what I brought with me there was I always hated it when I'd hear people only reference the number because
Right,
they're the ones that are so enwrapped in it. They just rattle it off because that's their thing. And
right.
it used to drive me crazy because then I'd end up doing a word search in the legislative application to figure out which bill it was. So I'm with you there. I like to look those things up, have the note, and then have the full bill. We can
Yeah,
give some of these nicknames, I guess, with what they're trying to do.
yeah,
So anyway, I'm sure we'll talk to you again very soon. It's every week for Washington Policy on the Go, and something's changing. When you've got as many bills as you do to follow, something's going to be changing every week. So we'll
right.
see you shortly.
All
Thanks
right.
so
Thank you,
much.
Dave.
You bet.